The AstraZeneca opt-in registration yesterday saw nearly 1 million doses of vaccines being booked in just 90 minutes. While Kyrie today announced that the vaccine will now be included under the national vaccination drive, should the government consider the opt-in method again to speed up vaccination rate? We speak to Dr Farhan Rusli on expediting the vaccination process.
The reason why certain vaccines can't be opened up like that is because due to the logistics that actually has to play a role. So when you talk about Pfizer vaccines, they can only be given at certain locations, and it has to be set because due to the cold chain that needs to be monitored really aggressively. However, I've been saying this many times. You should use the opt-out method. Why not you just give all the entire population a date for their vaccinations according to their risk, and then after that, if they do not want to get the vaccines, they can opt out. So the reason why is because I think a lot of people do want to get vaccinated, but if they do not want to get vaccinated, they will have to go through a process to get themselves out. So we do not want this thing where you allow people to opt in, but only for certain vaccines. And for other vaccines, you have to wait for your turn. People are confused. Why is this vaccination not part of the immunization package? So then you think, if this is not part of the immunization package, should it be allowed or should it be counted as part of the herd immunity? Are these results published? So I think it's time we just say that whatever vaccine that's available should actually be part of the national immunization program.
Dr Farhan also suggests for people to be put on waiting lists to avoid wastage of vaccines.
I think, number one, you have to remember that you cannot waste any amount of vaccines that you have. So you should always prioritize the groups that need to get it first, so the high-risk groups. But at the same time, you have a waiting list of people who can actually make it to any vaccination centers at the back and call. So this way, you don't waste the dosages. This way, you ensure that the first priority is actually given to those people who actually deserve it. But at the same time, if they are not able to come and show up, the vaccines are given directly to those on the waiting list. So this should have been the approach. And I think that when the AstraZeneca vaccine was actually opened up for 60 years old and above, and the 1 million doses were not actually taken up by all the people as what they expected it, we have to see what was the reason behind it. Definitely there is a gap that we must address. Perhaps people who are 60 and above do not know how to register, because I am sure that there are more than 1 million people who are 60 years old and above who are still waiting to get vaccinated. They just do not know how.